Hello, I'm Ryan Ferdihert with the Center for Practical Bioethics, and this is the Clinical Ethics Corner. What does it mean for something to be right, or fair, or just? These ideas and other concepts within the principle of justice are a challenge at first because we need to understand and define these terms before we can apply them to clinical scenarios. As stated by Varkey, justice is generally interpreted as fair, equitable, and appropriate treatment of people. Of the several categories of justice, the one that is most pertinent to clinical ethics is distributive justice. Distributive justice refers to the fair, equitable, and appropriate distribution of healthcare resources determined by justified norms that are structured to the terms of social cooperation. How can this be accomplished? There are different valid principles of distributive justice. They are distributed to each person by equal share, according to need, according to effort, according to contribution, according to merit, and according to free market exchanges. It is understood that some of these goals of medical ethics are to establish a system of justice so that concepts and benefits can be fairly distributed across. But the reality of this application is not always as ideal. Take this scenario for example. The patient was in his early 40s and recently arrived to the United States from another country and was here visiting family. At a family event, he collapsed and had to go to the hospital. At the hospital, he was given a recent diagnosis of cancer. The patient is not a legal resident and does not have what is called a path to insurance, either Medicare, Medicaid, or private insurance. The price of the cancer treatment is expected to be well over $5 million, but the hospital is unable to give an exact amount because of the nuance of the patient's situation, and because of that, the patient is not able to pay out of pocket. With treatment of around a 90% chance of successful recovery, but without treatment, the patient is likely to die relatively quickly. The patient would obviously like to engage in treatment, but to be fair and just, what does it mean for this patient? Does this patient deserve to receive the treatment? Does this situation challenge some concepts within the idea of justice? Should this patient receive an equal share or receive according to his need? How do we ensure that we treat this patient fairly? If we decide to provide the treatment for this patient without any expectation of payment, what about the next patient and the next patient that are in a similar situation? Does this mean that that patient does not need to expect to pay to receive any treatment? Is that fair? Is that justice? Justice and fairness does not always mean unilateral distribution of and patient satisfaction. Sometimes, in order to uphold justice, some patients might see their access limited. But how can that be a just system that expects some to suffer for the benefit of others? This situation shows how complicated it can truly be to uphold justice. Thank you. This was the Clinical Ethics Corner. I'm Ryan Furter with the Center for Practical Bioethics, and thank you and have a rest of your day.